It's one of the most common injuries among athletes in contact sports, typically happening after a bump, blow, or jolt to the head.
And you don't have to actually strike your head on the ground. You can sustain what's called a concussion at that point.
And more recent policy and rule changes have lowered the number of brain injuries in contact sports.
Decreasing collisions, number of collisions in contact sports, recognition of concussion, early recognition, implementing baseline concussion assessment tools so that we know what someone's baseline is. So should, if, or when they sustain a concussion, we have something to compare to.
If an injury happens during the game, Allison says they can assess athletes on the sidelines using the same app.
Arnot Health purchased Sway last year. It is a very easy, efficient baseline test that we can use for baseline assessment. We can also use it for sideline assessment. We can use it for recovery and monitoring signs and symptoms. It is all done from a mobile device.
Some symptoms can appear right away, but others may take hours or days to become noticeable.
Headache, dizziness, nausea, ringing in the ears, blurred vision, neck pain, head pain, facial trauma, numbness or tingling in the arms, face, or neck. You could be feeling in a fog, you could feel really tired, you could feel slowed down, you could feel really confused, unusually sad. Those are just some of the 22 symptoms.
Athletic trainers are on the sidelines for athletes from the start of preseason all the way to the last game of the year. And although Arnot Health's team specializes in concussion management,
athletic trainers and coaches and parents and athletes cannot legally diagnose a concussion in the state of New York.
After a doctor or physician diagnoses a suspected concussion, athletes will need to take time to rest.
No games, no screens, no TV, no cell phone, no gaming. Keep noise down and monitor symptoms as needed.
And contrary to some beliefs, Allison says rest really means rest.
Sleep as much as you need to.
Symptoms can worsen within the first 72 hours, and health experts recommend parents monitor their children. When the athlete returns to school and sport,
and that's where the school nurses come into play hugely for daily symptom checks. Athletic trainers also can do daily symptom checks.
No two brains are the same. Everything from behavioral changes to recovery time can vary from person to person.
You and I could each sustain a concussion. It might take you 7 to 10 days to recover, which is about the average time for most adolescents. It might take me 3 months.
The 2023 policies for preventing, evaluating, assessing, treating, and returning athletes was recently published, decreasing body checking and implementing mouthguard use in youth hockey, and restricting collisions in school-age football practices to reduce the risk of head injuries. For Arnot Health, I'm Lexi Cutmore.